We have representatives here at the annual meeting from all over the state. We're very proud to have 98% of the hospitals in the state of Mississippi as members of the Mississippi Hospital Association. The Mississippi Hospital Association is the heart of healthcare in the state of Mississippi. It's here to represent hospitals to preserve the quality and high standards of healthcare throughout the state. The theme of this year's annual meeting was the Sea of Change, and certainly we've been experiencing change in the state of Mississippi and in healthcare in general for a long time. And learning to adapt to that change is a big part of this meeting. And either we can be a part of that change and we can direct that change, or we will be changed.
I really always value an opportunity to interact with hospital leaders generally, but particularly at the state level and in their own marketplace, to get a sense of what's keeping them up at night. The kind of basic underlying trends of the move from volume to value, of providers getting in the insurance business or starting to take more risk, of reorganizing and redesigning care delivery to be higher performing. Those are common threads I hear all over the country.
Our key role is education and advocacy. We represent the heart of hospitals, and working both on a federal and a state level from a legislative standpoint or congressional standpoint to make sure that somebody is advocating not only for the hospitals but for the patients, the people we take care of, the reason we're in existence. That's what drives the association.
It's about putting the patient first, about doing the right thing, about understanding that we really do have very highly trained people, we have great facilities, and that if we build a better system of care, that's going to work better for patients, for providers, and for the pocketbook of the people who pay the bill. And I think great leaders are able to synthesize and cut through all the morass of difficulty, whether it be regulatory or political or economic, and get to how do we make a difference for patients and families in our community and do the right thing.
We listen as much as we talk. We want to hear from the membership. We want to understand how can we better represent this group. Because when we get out and we communicate the message, we have a very diverse group of people that we're talking to. So we need to understand from each of the hospitals the feelings of their community, the feelings of their staff, the feelings of their physicians, so that we represent that appropriately.
This will be the first time that we give out the Hospital for Hope awards. This is a new program that's a joint venture by the Mississippi Hospital Association and Mississippi Organ Recovery Agency to promote organ and tissue donation within the hospitals as a joint venture. A nice pat on the back for all the hospitals, because without the hospital's support we couldn't do organ and tissue donation. The collaborative effort that we see in our hospitals that we work with is amazing, and this is one of the ways we want to say thank you.
Down by the seaside, you sit and say.
Since the inception, this meeting has been very, very family-oriented.
On the day, all night, Marianne.
We looked around the room and we saw all the kids and we saw the families, and just it's a different environment. It's an opportunity for people to talk and get to know each other. It's a great opportunity to network, to establish new relationships, and in my mind, relationships is the key to our business.
You're still the one that I dream about. You're still the one that's the one that I wouldn't switch. We're still having fun. You're still the one. You're still the one. Oh, you're still the one. We're still having